The sterile white walls of a hospital are supposed to be a place of healing, of science, of answers. But in Mexico City, in 2014, for one young woman, they became the backdrop to a nightmare that science couldn't explain. This is a story that begins not in a haunted house or an ancient graveyard, but under the fluorescent lights of a modern medical facility, where the lines between medicine and mystery sanity and the supernatural would blur into a terrifying unknown. Her name was Sophia, a bright, 22-year-old student with a promising future. But in the spring of 2014, that future began to unravel. It started subtly. Insomnia, crippling anxiety, and a profound sense of melancholy that no one could understand. Her family, concerned, did what any loving family would do. They sought help from doctors, specialists, the best that modern medicine had to offer. Sophia was admitted to a respected psychiatric hospital in the heart of the city. Her diagnosis, a severe psychotic break, perhaps triggered by stress. The treatment plan was clear: medication, observation, and therapy. For the first few days, a quiet routine settled in. Nurses checked her vitals, doctors made their rounds, and Sophia remained withdrawn, a shadow of her former self. The staff was patient. They had seen cases like this before. Recovery, they knew, took time. But then, the quiet routine was shattered. It began during a late-night check. A nurse found Sophia standing rigidly in the center of her room, her eyes wide with a terror that seemed to look right through the walls. She wasn't speaking, but a voice was coming from her. It was low, guttural, and spoken a language the nurse didn't recognize. It was a cold, ancient sound that had no place in that clean, modern room. The incident was logged as a complex vocal tic, a symptom of her psychosis. But it happened again and again. The episodes grew more intense, more disturbing. Sophia, a native Spanish speaker, would suddenly speak in fluent, archaic dialects, languages she had never studied, never even heard: Aramaic, Latin. Her voice would shift, sometimes becoming the rasp of an old man, other times the layered chorus of many voices speaking at once. The content was always the same: blasphemous, hateful, and filled with a chilling knowledge of things she couldn't possibly know. She would reveal the hidden secrets and deep-seated fears of the very doctors and nurses trying to help her, whispering their private shames across the room with a malicious grin. Medical professionals are trained for crises. They are unflinching in the face of physical trauma and mental distress. But this was different. This wasn't in any textbook. Seasoned psychiatrists found themselves unnerved. Nurses, veterans of the most chaotic emergency rooms, began to fear their night shifts. They would find objects in her room thrown with impossible force, even when she was restrained. The temperature around her bed would plummet, leaving staff shivering in the middle of a warm Mexican night. Electronic equipment, like the heart monitors and 4 pumps, would inexplicably malfunction whenever she had an episode, their screens flickering and beeping erratically, only to return to normal the moment she became calm. The medical team was at a loss. They ran every test imaginable. Brain scans showed no abnormalities. Blood work came back clean. They adjusted her medications, tried different therapies, but nothing worked. In fact, the more they tried to treat her with science, the more violent and inexplicable the phenomena became. Sophia's physical condition was deteriorating rapidly. She barely ate, her body contorting into unnatural positions for hours on end, positions that should have torn muscles and broken bones, yet left her unharmed. Her family, watching her waste away, grew desperate. They saw their daughter being consumed by something that their modern world had no name for. It was a nurse, a deeply religious woman who had witnessed one of Sophia's most terrifying episodes, who first dared to whisper the word, possession. She spoke to the family, not as a medical professional, but as someone who saw a spiritual sickness that no medicine could touch. The suggestion was met with skepticism by the hospital administration, but Sophia's family was out of options. They had put their faith in science, and science had failed them. Now, they turned to a different kind of faith. Through their local parish, they made contact with the Archdiocese of Mexico, an institution that has been dealing with the concept of demonic possession for centuries. The church does not take such claims lightly. An investigator, a seasoned priest trained in psychology and theology, was dispatched. He spent days with Sophia, observing, interviewing the medical staff, and reviewing her extensive medical file. He was not looking for proof of the paranormal. He was looking for any earthly explanation he might have missed. But the more he saw, the more he became convinced. the aversion to sacred objects, the knowledge of hidden things, the speaking of unlearned languages, the superhuman strength, it all pointed to a textbook case, straight from the Vatican's own guidelines on exorcism. Permission was granted for a rite of exorcism. The setting for this ancient battle was surreal, a private room in the hospital, stripped of all but the most essential furniture. The hospital, in a controversial and unprecedented move, agreed to allow the rite on its premises, but under strict medical supervision. A doctor and a nurse were required to be present at all times, monitoring Sophia's vital signs. The lead exorcist, a quiet, unassuming man in his late 60s, arrived not with fire and brimstone, but with a quiet sense of purpose. He was accompanied by 2 younger priests and a few trusted members of Sophia's family. The windows were covered. The only light came from a few flickering candles and the cold, green glow of the heart monitor. The air was thick with a tension that was almost physical. The rite began simply, with prayer, the Lord's Prayer, the Hail Mary. The priest's voice was calm, a steady anchor in a gathering storm. At first, Sophia lay still, her eyes closed, but as the Latin prayers began, her eyes snapped open. They were filled with an ancient, bottomless hatred. What happened next is difficult to describe. It wasn't like the movies. There were no spinning heads or levitating bodies. The horror was quieter, more psychological, and far more terrifying. The entity within Sophia began to speak. It mocked the priests, taunted them, using Sophia's voice, twisted into a venomous sneer. It blasphemed, it cursed, it promised them ruin. The room grew impossibly cold. A low, guttural growl seemed to emanate from the very walls. Sophia's body began to writhe on the bed, her limbs moving with a strength that belied her frail frame. The heart monitor beeped erratically, its rhythmic pulse descending into chaos. The priests never faltered. Their voices remained steady, a relentless chorus of faith against a tide of darkness. For hours, the battle raged. The spiritual and the scientific watched side by side, the quiet chanting of the priests punctuated by the frantic alarms of the medical equipment. The doctor present later reported that Sophia's vital signs were beyond anything he could explain. Her heart rate would spike to impossible levels and then plummet to near flatline in seconds. Her body temperature fluctuated wildly. Medically, she should have been dead. The turning point came near dawn. The lead exorcist, his face pale and slick with sweat, held his crucifix before Sophia, and in a voice that boomed with authority, commanded the entity by its name, a name it had inadvertently revealed in its earlier taunts. In the name of God, he commanded it to leave. A terrible, soul-shattering scream tore from Sophia's throat, a sound of pure agony and rage that seemed to shake the very foundations of the hospital. And then, silence. A profound, complete silence. The heart monitor settled into a steady, rhythmic beep. The cold in the room dissipated. Sophia's body went limp, and for the first time in months, she was just Sophia. She opened her eyes, and they were her own. Weak, confused, but her own. Her first words were a whispered question. What happened? In the weeks that followed, Sophia made a remarkable recovery. She had no memory of the events of the past few months, a gap in her life that doctors called dissociative amnesia. She returned home, finished her studies, and went on to live a normal, healthy life. The official hospital report lists her case as a spontaneous remission from a severe, unclassifiable psychotic disorder. The church's file is sealed, but for those who were there, the doctors, the nurses, the priests, and the family, questions linger. What really happened in that hospital room? Was it a case of mass hysteria, a mental illness so profound it mimicked the supernatural? Or did they witness a genuine battle for a young woman's soul? A clash between ancient good and ancient evil playing out on the sterile stage of modern science? We may never know for sure. Some stories don't have easy answers. They simply leave us in the dark, with the unsettling realization that there are things in this world that our science has yet to explain, and our nightmares have yet to imagine.